and Becky is our clerk for today. So I appreciate your help in guiding us through this meeting. So in my formal statement, I should welcome you to this meeting of the East Lothian IJB Audit and Risk Committee on 14th September 2021. It's being held remotely in accordance to the Scottish Government's recommendations as regards physical distancing during the COVID-19 outbreak. So could I ask the clerk to read the data protection statement, please?
Thank you. This meeting is being recorded and will be made available as a webcast via the Council's website in order to allow the public access to the democratic process in East Lothian. East Lothian Council is the data controller under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Council's policy on record retention, and the webcast of this meeting will be publicly available for up to 6 months. I will now take in attendance of members by roll call, and if you're substituting for one of the voting members, then please indicate this when I call their name. So Dr. Donald?
Present.
Thank you. Councillor Akhtar?
Present.
Miss Ireland? Don't think Miss Ireland is present. Councillor Kempson?
Present.
Thank you. And Mr. Binney? And I don't think Mr. Binney is present today either. I do have apologies from Alison McDonald.
Mr. Binney just came up on the screen, Becky, there as admit, so perhaps you might like to admit him.
Thank you. Oh, I don't actually have an admit, but I think perhaps Hannah will be able to admit him. Mr. Binney, are you able to hear us?
I am indeed, I'm here.
Thank you very much. And finally, can I check whether there are any declarations of interest, please?
No.
No.
Thank you.
Thank you, Becky. Could I just pause a moment and welcome David King, who is helping to cover the maternity leave for Claire. And perhaps, David, you'd like to introduce yourself. You probably know most people, but just to say a few words of welcome and background for us. Thank you.
Thank you very much. I think practically everybody knows me or has seen me at a particular meeting. Claire, as you know, has gone on maternity leave and she will be back in the spring. And NHS Lothian must provide a Chief Finance Officer to the IJB. The IJB must have a Chief Finance Officer. And through a somewhat circuitous set of circumstances, I'm now fulfilling that role. So this will come up again on Thursday, actually, at the IJB proper. But I'm fulfilling the role of Chief Finance Officer for the IJB until Claire comes back in the spring. Those of you who know me know that I was the Chief Finance Officer of the IJB until I retired in 2018. So it's nice to see some old friends, and it's nice to meet some new people. So I'm very, very glad to have this opportunity to come back, and I'm really enjoying myself doing this particular job. So I'm keen to support the IJB, and thank you very much.
Great, David, just having a little introduction myself with you earlier today. I am in awe of your experience, and I think the IJB and particularly our Audit and Risk Committee are very grateful to have your expert advice and guidance through these next few months. So the agenda, to follow the agenda, the first item is the minutes of approval. Becky, would you like to just introduce that?
Thank you. So the minutes of the East Lothian IJB Audit and Risk Committee meeting from the 8th of June, and these minutes are up for approval, please.
So I would like to ask if there are any comments or information or factual changes that anybody would like to make. I gave my apologies for that when I had a reunion with all my family, which was greatly appreciated. But I know that there are a couple of things coming up later, particularly item 7 Peter raised about the workforce. But was there anything else that anybody would like to say? So with that silence, I think we can approve the minutes, Becky.
Thank you. And so moving on to item 2, which are any matters arising from the minutes of the 8th of June.
So is anything that people want to bring up that is not included in the agenda at the moment? No, I think we're happy with that. people probably would have notified earlier. So we'll go on to item 3, please.
Thank you. So item 3 is the new SIPFA Financial Management Code 2021-22 and Best Value Audit Scotland questionnaire. And this is a verbal update by Mr. King.
Thank you very much. Apologies to the committee for making a verbal update. I appreciate that you haven't anything to look at, and therefore it's a little bit difficult. These are matters that came along relatively late on in the financial year, but I think it's something that we need to have a very quick discussion about. And I have some notes, and if it would help, I could give Rebecca these notes and they could be incorporated in the minutes. So there's 2 items. The first one is the SIPFA Financial Management Code. Now, SIPFA is the Chartered Institute of Public Finance and Accountability. I'm just reading that off my other computer. And that's a sort of professional body for local government accountants. Now, it's quite important to keep remembering, and people in health like myself are very guilty of forgetting this. The IJB is constituted under local government regulations, and therefore it has to, and quite rightly so, take cognizance of the various pieces of guidance and advice and regulation that local authorities have to look at. And SIPFA have produced a financial management code. Now, a lot of this is about the things that we have always done. You know, do we have a budget? Do we report in the budget? You know, are there proper sets of accounts? There's a lot of very, very good stuff. But what they've done is they've captured all of these things and they've brought them together. Now, a lot of this particular stuff pertains to kind of operational aspects. I mean, the IJB does not employ staff. The IJB is largely a board of governance, not a board of management. But that having been said, I think it's important that we have an opportunity to look at some of these things and consider how these things would reflect upon us. Now, I'm saying these things and I'm telling you what they are, but there is a long, detailed list of principles and a whole lot of standards. And my proposal would be, and as I say, I do apologise for not having done this, but my proposal would be that we come to the next meeting and I will write a paper. I will summarise these particular matters and I will ask you formally to consider these particular things and then decide on what we might do about it. Now, the key point here, I think, is that this, sorry, I've got an omission thing here. There we go. The key point here is that this guidance is in the current financial year, that is 21-22, a sort of shadow guidance. And although it's not going to be backed by statute, the presumption is that the guidance will be accepted formally by bodies, as I say, that are constituted under local authority regulations from 22-23 onwards. So we have a bit of space to have a proper think about this. And we also have to have an opportunity to think, well, you know, does this really impact upon the IJB given my previous comments? Now, the other IJBs have already adopted this standard, so I'm not suggesting we shouldn't, but I do think it's worthwhile having a bit of a consideration because I have no great desire to create sort of enormous amount of work and take a whole lot of boxes off that, quite frankly, they wouldn't really affect the IJB. So I'm just bringing this to your attention. I'm asking for your permission to bring it back to a future meeting. The second thing, excuse me, sorry, do you wish to ask questions on that? I appreciate it's just a verbal update, and if colleagues haven't heard about it before, then it's going to be very difficult to ask a question.
David, I think it's really helpful to have your summary paper
Yes.
to give us some guidance and not have unnecessary bureaucracy, but we need to be in line. Duncan, you wanted to make a comment, please?
Just a quick point of clarity. I think the Financial Management Code was in a shadow year in 2021 with implementation in 21-22. However, I think probably welcome a paper coming to the next committee outlining that. And I think the vast majority of things that are in that code are not new and are things that the IJB will have been applying for a number of years. So. But I think it is worthy of bringing a paper for confirmation.
Duncan, I think that's reassuring that you are not missing something really, that we are following guidance, be reassured by that, but there may be some modifications that we need to be more aware of. So I think we'll be assured that we're on the right tracks, but welcome further discussion through David next time. Thank you. So David, your other points.
Thank you very much. No, thank you, Duncan. I've clearly misread that particular bit. The second point then is the whole issue of best value. Again, sorry to repeat myself, but best value is a statutory obligation on the council, on bodies constituted under local government acts. Now, clearly, East Lothian Council have a principle about best value. The NHS also has a whole series of issues around best value. It doesn't actually call it best value, but clearly it has. It takes cognizance of this whole principle of value for money. And it's about ensuring sound governance. It's about good management. I'm reading this. Public reporting and performance, and a focus on improvement. It's about making good decisions as to use the resources available to you and making sure that everybody understands how these decisions are arrived at. So this is about the use of the public pound. Now, this is a statutory obligation. Duncan's point is actually a very interesting one. Again, this could end up being a very long and tortuous process that would add very little value. However, Audit Scotland have helpfully published 10 best value prompts, and they are suggesting that the IJBs look at these prompts. Now, a lot of this is already available. I mean, we already do some of this. The second question is actually a very, very interesting one. If you forgive me for a second, I'll just read it to you. It says, how do you receive assurance that the services supporting the delivery of the strategic plan are assuring best value? So how do we, the IJB, receive assurance that the work undertaken on our behalf by East Lothian Council and NHS Lothian is receiving best value or secured under best value? Now, I think the answer to that question is that we have very good relationships with them and we know that they have their own systems. But these are interesting issues. And again, I would like to this is a much simpler thing because there's only 10 points, but I'd like to summarise it up and bring it back to the IJB Audit and Risk Committee and have a conversation there. And then we can take a decision as to whether we want to take that to the IJB or not.
Thank you, David. That's a good proposal. How does everybody else feel about that? I mean, you're nodding your head. It feels a helpful idea. Gillian.
Thank you, Chair. Good afternoon, everybody. So Gillian Woolman, your external auditor, and very nice to see David back as interim Chief Finance Officer. I really welcome that David has drawn to your attention these best value prompts and the suggestion of having a proportionate response in order to take it forward in the context of your Health and Social Care Partnership. I was just going to remind everybody that a full scope best value assurance review was done of East Lothian Council, perhaps I'm thinking 2.5 years ago. I think some of you will be familiar with it, but there'll be quite a lot of material there. But I know that the Council has been very active in implementing the action plan that resulted from that. And I think that will be a really helpful source of information as the starting point for whatever review you do in the context of the IJB. So just an observation there.
Gillian, that's really helpful. And, you know, it's good to know there is a continuum here. And let's just reflect on what has been previously the principles, how people have changed things. Oh, what's happened to my computer there? Hang on a minute. Take those out. But yeah, a proportionate response. So we will trust David that he helps us to have a pragmatic view of these 10 principles so that we don't churn over old ground, but can look imaginatively at something that could be practical for our committee. So I think next meeting is going to be very exciting with all these ideas. So David, did you want to add anything else? But I think we have, as a committee, approved your kind offer of bringing together those 2 papers for further discussion.
No, that's fine. No, thank you very much. I'll take these things in hand. We'll bring it back to the committee in the future. Cheers.
OK, thank you. So Becky, back to item 4, please.
Thank you. Item 4 is the Independent Auditor's Review of the Annual Accounts, and at 4A, it's the Audit Scotland ISA 260 letter to those charged with the governance of East Lothian IJB, and we have Gillian Woolman to present. Thank you.
Thank you very much, Chair, and to the clerk for introducing this. And for anybody who's attending today's meeting who doesn't know me, I'm also the appointed auditor for East Lothian Council. And this is us moving into year 5 of the audit of East Lothian Integration Joint Board. And the first paper before you, which is numbered number 4A, is essentially the covering letter, just to let you know as members of the Audit and Risk Committee that we are indeed at the concluding stages of the audit of the 2021 annual report and accounts. In my covering letter, I'm confirming to you that I have applied and working with my team, and I must say I'm accompanied today with my colleague Mary O'Connor, who's online. We've applied international standards of auditing in the work that we've undertaken here. And indeed, as the Interim Chief Finance Officer has already mentioned, you draw up a set of accounts in compliance with local government accounting requirements in that regard. I'm pleased to say that we have no unadjusted misstatements that we need to draw to your attention at this concluding stage of the audit. And I remind you that we do seek representations from the Interim Chief Finance Officer at the concluding stage of the audit. This is very normal process that is standard to all audits. And turning to the next page, which is entitled Appendix A, you'll be pleased to know that the proposed independent auditors report, which you will now put within your annual report and accounts, is an unmodified opinion, and that's the type of opinion you want. That's me providing assurances. In the middle of that page, it says, in my opinion, the accompanying financial statements give a true and fair view. And that's with respect to your financial position at year end and the income and expenditure that is shown in the financial statements. You can see that the independent auditors report is quite long, and it follows a particular template, providing you with assurances about the basis for my opinion, conclusions with respect to the preparation of your accounts on a going concern basis. It also reiterates the respective responsibilities of the key officers and myself as the auditor. And then further on, it talks about other aspects of the accounts. So the Accounts Commission for Scotland require us to respond positively that you have indeed included, where appropriate, a remuneration report and any other statutory information. And for you, that's the management commentary and the annual governance statement. There's a section there, any matters I'm required to report by exception, and there are no exceptions that I need to draw to your attention today. So this independent auditors report will be included in your annual report and accounts, all being well after I've presented my long form annual audit report, which follows. You'll be in a position to recommend approval of the accounts to the board, which meets on Thursday, and it would be after the board approval that the Chief Finance Officer signs the letter of representation, the accounts are signed, and then I'm the final one to sign that independent auditors report. The next appendix, Appendix B, is the letter of representation, and again this is very standard wording, tailored to what's appropriate both at a UK level and at a Scottish level, and taking account of the fact that you are an integration joint board, and we look forward to David signing that on Thursday after the board has approved the accounts. So Chair, I'll pause at that point, but essentially that's just the covering letter at this stage.
Gillian, thank you for that. It seems to me that, reading the very formal presentation, that it gives us enormous assurance that actually we've done okay. That it's been checked and double checked at various different levels, and that there's no concerns seems to be the key phrase that we want to hear and are happy with. But I open it up to the committee to ask Gillian any questions or any comments you have to make. Gillian, Shameen.
Yeah, thank you. Thank you, Patricia, and thank you, Gillian, for presenting the report. I just take on board just the section 61, where there is good practice, where you mention in the examples of good practice from our Health and Social Care Partnership have been shared with the Audit Scotland NHS Lothian overview team, especially on the primary care mental health pathway, and I think that'll be welcomed for staff who have worked hard in really difficult circumstances, and we know the impact that mental health has been on people across the county. So I think that'll be welcomed, that those staff are aware that what they've been doing has been highlighted as good practice. Can I also note some of the other things that are kind of a bit more longer term that we don't know the impact of yet. So I take on board the long-term impact of COVID-19 has yet to be assessed by IJB, but I welcome your report. But there's a few things in there that just knowing what the long-term impact of some of the things that have been happening from COVID. But I welcome that you share that good practice in your report.
So, Chair, I will take the opportunity of going through item 4B, which is the long form annual audit report. You won't believe this, but workmen's just started in the background here, so I'm just going to ask them to stop for a moment. Just give you a second.
These are always things that are unpredictable, aren't they, in a meeting? And I understand we might be able to hear Gillian better. But Shameen, is there a way of feeding back to the staff our thanks for their hard work and the fact that their good practice has been shared? I think it's always a nice way to say thank you to the staff if it has come up in a more formal document. So maybe somebody could pay attention to that. Gillian, well done.
The message is reaching somebody to switch off that terrible noise. I hope you can hear me clearly in the meantime. So I'm on item 4B, which is our annual audit report. This is a standard report that we do at the end of the financial year. And the key messages, which are on page 3 of my report, these are the ones that are important for you to be, for the wider board to be familiar with. But because you're the Audit and Risk Committee, I am going to go through the body of the report. So first of all, there's the introduction there, which very much links up with the annual audit plan, which this committee received earlier in the year. And we have in paragraph 3 recognised the very distinctive nature of the year 2020-21 with a global coronavirus and everything that meant to you for the delivery of health and social care services, but also the impact that it will have had on staff members. So pressing on, I'm turning to part 1, and this is on page 6 of this report. This is very much focused on our audit of the annual accounts. So once again, there we mention it's an unmodified audit opinion. We've also made reference there from paragraph 15 onwards, the degree to which the COVID-19 pandemic impacted on the audit process, and you'll be pleased to know it didn't. I have to say, I think you're in the minority of cases in that regard. It's been quite an impact on the whole external audit process. At the foot of that page, I start references there to materiality. This is helpful for both the work of the audit team and for finance officers to know that where we find differences bigger than these, we would start doing additional audit work and ask for changes to be made to the accounts. So that just sets the scene for the level of precision we operate to for the purposes of the audit. There's a cross-reference there to Appendix 2 in paragraph 21, and I will take you through some of the detail of that because we included those risks when we were at the planning stage. But the important heading just above paragraph 22 is that we have no significant findings to report on the accounts, nor identified misstatements that exceeded our reporting threshold. I have to say that's quite a rarity to have an assertion like that at this stage of the audit. And there was, you'll notice in paragraph 24, there was a small item, and that was attended to prior to the finalisation of the accounts. So moving on to page 9 and paragraph 2, part 2, financial management and sustainability. I can imagine that these are areas that have dominated the discussions of the board throughout the year, as you've had to manage your resources to attend to the priorities as they changed during the year, and also in consideration of the new foundation for your financial planning going forward. So you'll see in the main judgments there, we give you positive assurance about the financial management arrangements you have in place. There was indeed a medium-term financial plan that will require revisiting in light of the new world and new priorities. And we also make reference to the fact that there was increased spend during the year as a consequence of the IJB, of the COVID-19 pandemic. But it was funded, but that was quite late on in the year, and I think you had to manage the finances throughout the year to know what the outcome was going to be like in the end. So paragraph 27 onwards, talking about the underspend. So as I say, you had to monitor that throughout the year, and in Exhibit 3 there, we've captured the final underspend was in the region of 7 million, and you have earmarked these as reserves for going forward, knowing that you will have future spending commitments arising from the pandemic. Just above paragraph 31, we provide you with assurances that we believe the budget processes you have in place are appropriate to your circumstances. And then in the next section, just above paragraph 36, we make reference to the medium-term financial plan. We've got quite a bit of detail there about the processes you had in place, but we do have a recommendation there about the times right now for revision in light of the new challenges and new ways of working. Moving on to page 12, a reference there, the integration scheme is a very important foundation for all of the work that you do. David, as Chief Finance Officer, referred to your role as a board of governance as opposed to management, and the integration scheme is a very important link to your two partner bodies for the services that you commission, and you'll be wanting to stay on top of that. So last updated in July 2019 for you as an organisation. Paragraph 44, a reminder that you're dependent on your two partner bodies, and we connect with the external auditors of NHS Lothian and the Council to get assurances that systems of internal control are operating in a satisfactory fashion. And again, paragraphs 45 and 46, again, a degree of dependency on your partner organisations, but you also have a code of conduct for yourselves in place. So turning to page 13 and section 3 of our report, this relates to governance, transparency and best value. So we note here changes to governance arrangements and also the recent change in Chief Finance Officer that provide assurances about the arrangements that you have in place. At a high level, we make reference to best value, but we do welcome the reference earlier to having a firmer grasp about what that means to you in the delivery of services. And I think it's always important not to mix up best value with value for money. The best value is much broader. It has concepts such as partnership working, community empowerment and engagement, leadership and governance. So these will all be areas you'll be wanting to look at the framework and articulate how you meet all of those best value characteristics in due course. We make reference on page 14 about the very important Feely review, the independent review of adult social care services. And from my interaction with IJBs, I'm the appointed auditor for 4. We know the extent to which health and social care partnerships are very engaged in this and what it means for the delivery of those services going forward. And the second half of page 28 relates to your annual performance report. This is also important for public accountability, but we are pleased to see that you have performance information available during the year, but we are saying in paragraph 58 and indeed recommendation 2, more could be done to ensure the information is presented in a timely fashion to the whole of the board. We know that arrangements are in place for management, but it's the board engagement with actual performance we are emphasising there. And our final page makes reference to national performance reports, and as already highlighted by Councillor Akhtar, we have indeed drawn out good practice, the case study that you've included in your annual report and accounts for the establishment of the redesigned primary care mental health pathway, and we found that a very interesting read in your annual report and accounts. Turning to the appendix on page 16, these are the recommendations. There's just 2 of them at the conclusion of this year's audit, and we have satisfactory responses from management to take that forward. And then Appendix 2, this is an important aspect of our reporting. This is on page 17 of our report. On the left-hand side, these are all of the risks that we identified at the planning stage. We have management's assurance procedures in the middle section, and then the right-hand column lets you know the audit work we did and our conclusion at the end of all of that work. So that's important for you to see the completeness of our 2021 audit work. And finally, Appendix 3, there are web links there because I think there are quite a few reports that will be of interest to a health and social care partnership. I'm looking there at affordable housing, the 2 local government reports, and indeed some members may have a particular interest in the improving outcomes for young people through school education, thinking of the Christie Commission and the Prevent agenda there. So Chair, Mary and I are here today to respond to any questions, but the report is here to give members of the Audit and Risk Committee confidence about progressing with approving the accounts. There we go. Thank you.
Gillian, thank you very much for helping us to go through a very comprehensive report. And I must congratulate you, Mary, and everyone else behind the scenes for your thorough review, but also your understandable presentation for those of us that are not so closely involved. And I think with that confidence that actually everyone's done well, I would like to record our thanks to everyone involved in the finances of the East Lothian IJB, that there were so little concerns and areas that were a problem. So David, would you like to make a comment?
Yeah, I'm sorry, Chair. Yes, obviously we accept the recommendations. The recommendation about financial sustainability, which I guess means a kind of balanced multi-year financial plan, is something that we've been pursuing. And Claire put a set of slides to an IJB workshop, and you start to, you look at a financial plan, and it generally has a whole future financial plan, generally has a whole series of gaps in it. And she started that whole, well, not started, but that whole dialogue that needs to take place about what is the IJB going to do in order to start closing these financial gaps? What kind of transformational work that the IJB is planning to deliver will close these financial gaps? And we all know the principles behind the IJB's, the whole business of the balance of transferring the balance of care, and what does that mean in financial terms? So I just like to assure the committee, and I will assure the IJB when I speak to them on Thursday, that we are working on that. The last thing that Claire said to me was to certainly drive that financial plan forward in her absence. And I know that Alison is very keen to work on these matters as well. So I just wanted to assure the committee that these things are going to be developed. It's worthwhile noting, actually, certainly Claire and somebody called Lynn Allen were the people who actually drew the document together with, of course, a huge amount of work from other people. And the IJB's books of account are kept by East Lothian Council, so we should probably thank them as well for their efforts.
Thank you, David. Yes, I think behind all these words are a huge number of teams of people working away, and perhaps they're with working from home in small offices and don't have the benefit of seeing the final outcome. So yeah, big thanks to all involved. And I think the one thing that was interesting to me was the 7 million that we are underspend. And I imagine the IJB will be looking at how we should be using those general funds. And most appropriately, perhaps not just in a pilot, but actually ongoing support maybe to the workforce. But I think that's for the IJB to discuss rather than us, isn't it? That we have to assure ourselves that the accounts are clever and confident, and that we can say as an Audit and Risk Committee that we recommend the signing of these accounts at the IJB meeting. So has anyone else in the committee any comments to make before we are happy to accept Gillian's comments and review? I think there are no comments there. I think, do we need no, we don't need a roll call, Becky, for this, do we? We just say a big thank you to everybody.
Yes, no roll call vote is needed just because the reports are for noting. So if everybody's happy to note, then we're just able to move on.
Excellent. Well, I think the committee's happy to move on, and thank Gillian and Mary for presenting such an understandable report for us all. Thank you. So item 5.
Item 5 on the agenda is the IJB audited annual accounts, and it's Mr. King to present.
Thank you very much. This, in actual fact, then we'll need to take a vote on. I do apologise. So the committee is asked, having noted the opinion of the IJB's appointed auditors, and it was very, very useful to have that very, very good explanation from Gillian there. that you recommend the signing of the annual accounts to the Integration Joint Board. And as Gillian said, we will thereafter they will be signed by myself as Chief Finance Officer, by Alison as Chief Officer, although she's actually on leave, and the signing will take place slightly later on, and Peter Murray as Chair of the IJB. So basically, the annual accounts are attached. I think Gillian's described it much more adequately than I can. So I think I'm simply asking the Audit Committee's approval, or the Audit Committee's recommendation, that the IJB can now ask us to sign the annual accounts.
Thank you, David. I realise this is a formal process that we go through between Gillian's explanation and David saying we have to then now formally vote to propose this. So have we any other comments from anyone before we take a roll call? Shameen.
Thank you. Thanks, Patricia. There's a section in there, David, I just wondered if there was any update on it. NHS Lothian have submitted their remobilisation plans to the Scottish Government for April 2021 to March 2022. And I just wondered if there was any feedback at all we have on that.
I'm afraid I don't have any feedback on that at this particular point in time. I'm sorry about that. I will ask for further information from my colleagues in NHS Lothian.
Thank you.
So are we happy to take a roll call on this? Any other comments? Don't see any other hands up. So back to you, Becky, for the roll call.
Thank you. So having noted the opinion of the IJB's appointed auditors, the committee, we're asking whether the committee agree to recommend the annual accounts to the IJB. So if you could indicate whether you support that. Dr. Donald?
Agree.
Thank you. Councillor Akhtar?
Agree.
Thank you. Councillor Kempson?
Agree.
Thank you. And Mr. Binney?
You are muted. David, you're muted.
Agree. Sorry, I'm having a bit of difficulty here.
Thank you very much. So that has been agreed unanimously.
Thank you. So on to item 6, please.
Thank you. And item 6 is the risk register, and we have Mr. King presenting.
Thank you very much. As members are aware, that this is the Audit and Risk Committee, and therefore one of the things we have a standing item of is the risk register. Now, I was having a very useful conversation with the chair before this meeting started. Excuse me, and we were just reflecting on the purpose of risk registers and the management of risk registers. Now, we are the IJB, we have a clear goal and ambition. So what should be on our risk registers are the risks to the IJB. And what the IJB does is it prepares a strategic plan, and then it delivers that strategic plan by issuing directions to its partners, East Lothian Council and NHS Lothian. Now, on that kind of basis, and there are unquestionably extraordinarily difficulties in recruiting staff for healthcare and for social care and general practitioners, etc., etc., etc. That's a risk to the IJB strategic plan, but it is not a risk that the IJB can manage. It's a risk that has to be managed by NHS Lothian or East Lothian Council. So the first question that we always struggled with was what risks should appear on the risk register? And the second question then is what are you going to do about them? I mean, there are some risks about which we can do nothing, COVID being the classic example. And the chair made a very, very good point. It's not necessarily about doing something about the risks, it's being aware of the fact that they are risks and therefore they might happen. So what I've tried to do is to sort of run through the risk register as it existed, update some of the dates because some of the dates had moved on. There's one or two actions that require to be tidied up. And I was left with a couple of points. First of all, you asked to have the issue of demography put on the risk register. And the question is, what are we going to do about demography? Well, demography is not a new risk. The problems of an ageing population have been known for a long, long time. And one could argue that one of the whole reasons behind integration was to try and force much more collaborative working to try and deal with issues like an ageing population. East Lothian's population is going to increase. Again, that's not necessarily a new risk, although it's a hugely challenging risk because the resources that follow population increase follow with a long time lag. And therefore, there's always a problem that you're presented with more people for whom you have to offer care and not necessarily more resources in order to deliver that care. So I have tried to reflect that this is something that the IJB strategic plan has been considering and something the IJP strategic plan will have to continue to consider. And excuse me, I do apologise. And it's something we probably need to note back at the strategic planning group and consider how we move these things forward. So there aren't any actions underneath the demography risk, and that certainly needs to be worked on, developed and brought back. The other thought I had then, and this was raised earlier on, I think by Gillian, was the consultation on the National Care Service. And if you read that, you'll see that that would make a very, very significant change to the IJB. In fact, it would create a new body. Now, is that a risk to the IJB? Well, clearly, yes. On the other hand, what can we do to manage it? And again, I think the key thing here is we need to be aware about it. We need to be aware of it. I think we also, and forgive me for preaching, but I think we also need to continue doing all the things that we are doing, because obviously we're not going to sit here and wait till it happens. We're going to carry on developing these things and trying to deliver integration and transformation of services. And then this is in the hands of the Scottish Government and the whole democratic process as all these things are rolled through. So I guess my last question to the Audit and Risk Committee is, should we have the National Care Service review on the IJB's Audit and Risk Register?
So there are a couple of key questions, but also the risk register. So should we go with the key questions first and then go on to the full risk register if there's any other comments about that? So should we start with the demographics and how do we explain or itemize the demographic risk of increasing population, aging population into our specific Audit and Risk Committee risk register? Has anybody got any comments or ideas about this? David?
A sort of slightly random thought. The demographic risk is not just of an ageing population or an increasing population. Part of the democratic risk for East Lothian IJB and its delivery agents is the increasing disproportionate number of care home places being built within the county, which is a specific element in terms of risk compared to just the general demographics. So you've got mitigating things like, are there planning issues that need to be addressed, and how are the general kind of uplift requirements of GP support for such facilities created? Those are for the delivery agents, but that's part of the picture that we're looking at in the demographic risk. It's not just the straight ageing and increasing number of population.
No, that's a really good point, David. And Ian, you want to add something else?
I suppose it was 2 points around what we need to do to mitigate this risk, and one of them, I think, probably, David, is just around understanding the financial offer from each of the partners. And again, this depends on the results of the NCS, but do those offers then account for demographic changes as we see them coming? So Wallyford's development of 10,000 people, Blindwells being another, will place pressures financially on all of our services. We should see a percentage uplift based on the demography. So I think that might be one, just very particularly for this group, to ensure that with each set of with each annual financial offer or with each set of annual accounts, there's recognition of the demographic shift that's adequately accounted for. And if it's not, that would be something that would need to be monitored, I suppose, and acknowledged that there was a significant, a recurring gap there if that wasn't met. And I think the second in that element, and we'll pick this up through, for example, the provisioning work as we start to finalise that, and through the SPG's work on GP premises. But I suppose the second is infrastructure. So David Binney's mentioned it there around care homes. And that's something we're looking at through the provisioning workforce to say, actually, what is our understanding of new care home places versus existing care home places, both private and public funded, so that we can understand the implications long term. But if I was the recent consideration at the SPG, for example, on GP premises requires us to then make a request, as we don't hold a capital budget, that NHS Lothian integrates that into their capital plan for primary care that then needs to be fed back, so we understand if there's an infrastructure following the demographic shift. And that would be the same for East Lothian Council facilities that we need to occupy, adult resource centres, etc. So I think those would be, I think, the 2 points that I would have in my mind that we'd need, where the IJB would be able to acknowledge that there was financial and infrastructure support from each of the partners to meet the demographic shift.
Thank you, Ian. David, did you want to come back?
Apologies, I'm having trouble with my buttons.
So you didn't want to add anything else? I was wondering about health inequalities. Does that come into the demographics? But Shamin, you have got your hand up.
Yeah, no, I agree with both the points made by Ian and David. And I think from a kind of elected representative's point of view, I think it's important to put it on the risk register, and that enables to raise those issues through the democratic processes that are available to us. So, for example, the council is currently looking at its second iteration of the local development plan. So when that did come to council, we have said to officers who are working with Scottish Government civil servants in the planning department that it's really important that you don't just look at infrastructure, roads, etc., but also health infrastructure, which has already been touched upon, and that engagement also needs to be with the health section of Scottish Government civil servants, whoever is the most appropriate. So there's proper joined up government policy and thinking on how we move forward. So I think for me, it's not just about the services, but how we ensure appropriately and robustly raising those issues at the appropriate levels to ensure that that has been thought about, and those decisions on funding, etc., and policy making are made appropriately for us, not just for East Lothian, but the whole South East of Scotland, which is taking the largest amount of growth in the whole of Scotland.
I think these are all good points. So, David, how do we react to that particular risk item? Can you help us with words and bring that back to the next committee?
Yeah, I'll try and capture. I mean, these are very valuable points. We'll capture some of these actions and make sure they're recorded in the register. And I think we'll certainly. It's a very well-made point that I said earlier on, that the financial resources follow the population, but there's a time lag. The council has what's it called, JE mechanism, which gives it allocations. That having been said, that what we require to do is, when the council resources, not just the council, sorry, also the health board, they have a model as well which changes their financial allocations. But as these resources become available, again, that doesn't mitigate any of these other problems. We need to tackle other issues. That we make sure that the resources come up to the IJB, because clearly, and Councillor Akhtar's points are very well made. One, there are other IJBs around here who also have growth issues. So there's and there's pressures all over the system. So there's a challenge to make sure the resources come to the appropriate place. But there's also the issue of having to live between the times of the population increasing and the resources becoming made available to meet these pressures. So we'll capture that in some of the actions, and we'll update the risk register accordingly.
Thank you, David. It comes into best value, I think, too, doesn't it? How we sort all this out. So I think we're in agreement about that first question. The second question then is about the National Care Service, and should that be on our risk register or noted for awareness? Does it fit on a risk register? So David, could you help us with this?
Sorry, David. Which David?
David Vinnie had his hand up.
Apologies.
too many Davids. Thank you. National Care Service. It seems very likely, highly likely, that there will be a National Care Service. But nothing in life is certain, certainly nothing in politics is certain. But given that there's a high likelihood of it, and given that David King earlier said a very nice phrase that the IJB currently is a board of governance, and if it moves to be a National Care Service or the delivery agent of a National Care Service within East Lothian, it would become a board of management and board of delivery. So what you have in front of you is a change programme. And where you have change, you have risk. So it would seem sensible, therefore, that such a proposed change, given that it's still at its embryonic stage, but given that it's likely to move pretty rapidly to a conclusion over a longer term, but pretty rapidly initially, it should be on the risk register. And the key to success is the quality of the transitional planning that the current IJB would be undertaking to achieve the ultimate goal of becoming an element of the National Care Service within East Lothian. Thank you.
Thank you. It does look as if the risk is in the transition, isn't it, of the changing role. And actually there's a risk that the IJB will no longer exist. So it's almost self-exclusion. But it is about the risk to delivering services whilst changing. So that would make it a good reason to have an awareness on a risk register. But any other comments from the rest of the committee? Shameen.
Yeah, thank you, Patricia. No, I agree with the comments that David has made, and I think we've seen some of the comments, people might have already seen some of the comments made by the Convention of Scottish Local Authorities of the importance of having that local link. You make the biggest difference to our communities when we're closest to them and they have the close level of accountability and transparency, and I think that's a huge, I think, a strength for us in East Lothian, that we have that close working partnership with the IJB and our partner organisations, and are able to quickly change if required to meet the needs of our local communities, and those decisions can be made locally. And I think I'm always very reticent of seeing centralisation as a way of making something better, because every part of Scotland is very different. We have different needs, demographics, rurality, etc. So I think we don't want to lose that. I see that as a strength, and I wouldn't want us to lose that strength, that local connection and that strength. So I agree with it being a potential risk.
Yeah, there's often a risk to delivery of services and changing relationships whenever there's a reorganisation. So I agree that when we've got those good relationships and connections in East Lothian, we don't want to lose that. So David King, can I come back to you and say, are you happy to actually put this on the risk register for us in taking into account our discussion?
No, I absolutely agree. It should go on the risk register. I think the point about transition planning is very important. I was at a meeting earlier on where this was discussed, and there was concerns about the baby getting thrown out with the bathwater. We have done a huge amount of integration in the last 5 years. It may not be as much as we would have wished. It may not be as much as the government would have wished, or indeed the population whom we serve. But this is clearly a risk, and we'll put it onto the register and look at the actions that we can take and to try and support management of it.
Excellent, thank you for doing that. And so just wondered if we need to just look at the rest of the risk register. Are there any other comments about any of the risks or any updates that people would be looking for? Ian.
Apologies, I just realised that there's an omission on the first risk 5045, where it's noted that NHS Lothian Gold's currently stood down. It was stood back up 8 weeks ago, I think. So I'll get the exact date and just add it to the risk register, and sorry for the omission.
Apologies, it was me who updated the risk register, so it was my fault. So yes, thank you, Ian.
Thanks, Ian, because the COVID is a continuing and changing risk. There's also all the immunisations and everything else that goes with that for the partnership to implement. But I do think that for the risk register to be helpful, we need these regular updates, and I don't think they need to wait for a committee meeting. I think there's something about just keeping it a live document and then bring to the committee the changes or the alerts that we need to discuss from time to time. So is that back to you, David? Are you happy to continue to monitor our risk register for us?
Yes. It's my fault. I should have had a more detailed conversation with Ian to join these bits together. But yes, we'll sort that out for the next meeting.
There's no fault. Everybody's terribly busy, so that's why we have committee meetings and everybody can share their thoughts. So thank you to everybody on that. So do we need? Yes, we need a roll call vote for items 2.1 and 2.3. So I'll go back to Becky to do that.
Thank you. So the committee is being asked to note the current risk register, and the committee has considered if the Scottish Government's consultation on the proposed National Care Service should be included in the risk register, and also any other further risks to be added to the risk register. So we'll just take a roll call vote on that, please. Dr. Donald?
Agree.
Thank you. Councillor Akhtar?
Agree.
Thank you. Councillor Kempson?
Agree.
Thank you. And Mr. Binney?
Agree, thank you.
Thank you very much. That's been agreed unanimously. And item 7.
Item 7.
Thank you. Item 7 is the internal audit report for the East Lothian Health and Social Care Partnership Workforce Development, and we have Duncan Steinbank presenting.
Thank you very much, Rebecca. The purpose of this report is to inform the Audit and Risk Committee of the recently issued internal audit report on the East Lothian Health and Social Care Partnership Workforce Development. The review was undertaken by the NHS Lothian Internal Audit Team and was reported to the NHS Lothian Audit and Risk Committee in June 2021. The report provides for moderate assurance over the workforce planning framework and significant assurance over the workforce plans and the governance arrangements in place. The report, in conclusion, says that within its 2019-2022 Workforce Development Plan, the East Lothian IJB Health and Social Care Partnership has documented a workforce development framework in line with Scottish Government guidance. The IJB Health and Social Care Workforce Development Plan clearly states the strategic objectives of the present IJB strategic plan for 2019-2022, and a number of these objectives have been taken forward into the production of a one-year health and social care workforce development action plan. The key issues shown in the report were the health and social care workforce plan at the time of the review and the workforce action plan did not reflect the workforce developments arising from the events of 2020. And at the time of the review, a lack of dedicated staff in the role of workforce development were in place. There were three, the three areas. So the other two are the detailed service and workforce plan had not been developed to support the health and social care workforce planning framework, with additional workforce plans in place across the partnership recording similar actions. And meetings of the health and social care workforce planning and development steering group had not taken place since February 2020, with monitoring arrangements from the health and social care workforce plan not followed as a result of that. I understand that all of the recommendations made in the report have now been progressed and will continue to do so. And I now open up for questions from the committee.
David, we'll let you go and wish you good luck with your health. Thank you for your apologies.
Thank you.
Duncan, workforce development is just the biggest risk and worry for us all at the moment. And I appreciate that your paper is reflecting back about things that just went on hold. I am reassured that we're picking these things up again. And there was also a point that I think you made that a development officer's post wasn't filled, but is now filled. I think that's right. But for me, this is such an important topic, is that we cannot deliver services throughout the system, either coping today or planning for tomorrow, without a workforce. and this is just so fundamental, that can you help us to understand that we are actually moving forward with workforce development, or in finding new ways of developing strategies to find our way through this?
Absolutely, and I think there is within the report, it reflects on the fact that obviously the events of 2020 and COVID-19 have been a significant shock to what would be workforce development plans that were in place prior to that, and therefore need to be taken account of, and that is progressing. And the report also notes that there is work ongoing between all of the IJBs within Lothian, as well as the NHS, to work together on workforce development plans. And I suspect Ian probably has something to say in this regard as well.
Ian, can you give us a wee update too?
Yeah, absolutely. I think this has been, there was a set of decisions made and attached to this because of the crisis of last year. The post was a retiral. That we required to recruit behind it. The recruitment took a long time. It wasn't stagnant. It was that we went for 3 attempts to recruit and they were unsuccessful until we were eventually able to find someone who I think is an excellent fit, and we are very much progressing that actively. Similarly, the partnership, these are being picked up through our partnership forum, and we're actively engaging with workforce planning and development processes across both agencies. I think what will be interesting, and again this is part of the national care service development that we need to think about, is the workforce that we are trying to achieve as an IJB and what that means strategically. So we've already talked today about some of the benefits of, example, the mental health workforce that we created in response to the pandemic, which is a combination of mental health OTs and clinical nurse, community psychiatric nurses working very, very effectively. We could see opportunities in that to work with the third sector and to work with social work and to understand all those needs for the community as they have them. It'll be interesting for us as an IJB as to whether or not that becomes a strategic workforce development for us, or if the development of NCS changes that focus and changes our direction on that. So I think we can give absolute confidence, Patricia, that at this point in time as an IJB and as an HSCP, we've got the right people in post and the right processes back up and running to progress this within our current strategy. I think it comes back to the previous discussion on what the wider national discussions mean for the workforce that we need to develop. Sorry for a long-winded answer.
No, I think it needs a long-winded discussion in various different forums, and I suppose I just have to try and think of where it sits within the Audit and Risk Committee, but it is surely a risk. And I'm very pleased that there is a collaborative discussion across the other HSCPs, and probably will come up at IJB. Ian, is there a way of bringing this back to this committee for assurance, just to see how it's progressing with the new officer, maybe in the next meeting or two?
Absolutely happy to.
Grand. Any other comments? We're happy to continue to explore the challenges. I volunteered back at work, which was actually a great insight in using my GP experience on the COVID hub and a vaccinator, and I'm very reassured that there are a huge number of volunteering vaccinators, and the news today that we're going to be doing the over 50s with the flu jag is going to be a big challenge for everybody, and also obviously East Lothian. But we don't need a roll call vote on that, but we're very happy that we should have a little bit of a feedback on the workforce development for our next meeting. So Ian.
Sorry, Patricia, I'm just wondering for a point of clarity for what you'd like back. So we can provide an update on the infrastructure we have around workforce development and the plans that are in place and where they're progressing. But I think there's also is something around the risk that we have to workforce development because of, I think, challenges that we try to create integrated models of care as we're required to do. And because of professional silos, that becomes quite difficult sometimes. So we have situations where we can see how, for example, the role of nursing can really support the development of home care and that assessment of risk within the community. But fundamentally, to have nurses managing home care staff is quite difficult for us to bridge. So that's something the HSCP works on sort of daily to try and, or examples like that are things the HSCP works on to try and deal with those challenges of integration. So I guess my question is, we can bring something on the planning. Would you like something on where we see the challenges of that workforce development are and where that might be a risk to the IJB strategy?
Personally, I think that's where we should be taking our discussion, because some of the risks are that we are pinching from another area, or we're moving people with different skills. Are we getting best value from the skill level that people have managing different teams across different sectors? So if it is appropriate for this committee, personally, I feel it would be, but if everyone's in agreement, I think I would like the two parts to that. It is having the structure confirmed and assurance that that is in place and moving forward, but also maybe delineating the risks within that workforce challenge. And if you're happy with that, Ian, then I would leave it in your capable hands to bring something back for a good discussion. Is everybody in agreement with that course of action?
Yes.
Good, that sounds all right. And Ian says happy to work on that basis. Well done, team. So we don't have any other business in these meetings, but have we any last minute reflections or comments that anybody would like to make? No, in that case, I will thank you all for your active participation and the hard work that goes into all these meetings. And I think I have to ask you to mute your microphone at the end of the meeting. And I wish you well, and we'll see you at the next meeting. Thank you very much.
Thank you, Patricia.
Thank you.
Thank you.